Howdy, coding pros, and welcome back to the Coding Break podcast. I am your medical coding coach, as well as your coding break reminder, Tam Talk, here to talk about all things coding related, which includes the good, the bad, and perhaps some of the ugly side of medical coding. So on today's episode, I want to talk about or touch on the subject of the type of roles that a medical coder can fulfill. Now, of course, if you studied to become a medical coder, the ultimate goal is to actually do some medical coding. And I get that, I understand that, but there are so many other options or opportunities that we can pursue with the medical coding certification. So I solicited the help of my very friendly compadre AI, or artificial intelligence, to kind of help me run through a list of some of the roles that we can fulfill. And I will say some of these roles are, to me, are redundant. And again, it will depend on the organization that is doing the hiring. And then I will also say that some of the roles that I will touch on are some of the roles I actually fulfilled. And I can attest whether or not certain roles are like intertwined, or again, the AI was just very redundant with the listing of roles. But nonetheless, let's get started. So, of course, the ultimate or the number one role is to become a medical coder. Again, a medical coder. So what exactly does medical coding entails? So according to AI, the medical coder role is pretty much translating medical documentation or aka review of patient medical records, such as the physician or healthcare practitioner's notes, lab results, diagnosis, treatments, and the like, and converting that information into the correct or the appropriate medical codes, which are used in the ICD-10 and CPT medical coding system. And so yeah, that's pretty much standard. And I guess to put it in practical terms, a medical coder is like the interpreter or the foreign language interpreter or translator of foreign information. So we are the foreign information or translator, interpreter for medical services or healthcare services, and we translate that into codes or terms or alphanumeric terms. Let me say it correctly. Alphanumeric terms for the insurance companies in order to seek reimbursement. So we are the communicator of healthcare services to the healthcare payers, bottom line. And so we ensure that the coding accuracy is accurate and also that we're following within the compliance or regulation, the law, the guidelines, so that we're following the law. And then again, like I said, we communicate with healthcare providers. And let me go back and say, I remember when I started out or when I was in leadership, some of our coders were nervous to talk to healthcare providers. It's almost like the same fear that you experience when you have to do public speaking. Some of the coders had that same fear when it came to communicating with healthcare providers. They're humans. They are humans. This is how you get your information to ensure that your coding is accurate. So there's no need to be afraid of your providers, your doctors, your nurse practitioners, PAs, what have you. You have to communicate with them. That's like one of the biggest parts of the job, is communicating with them, is to ensure that when you're coding or you're selecting your codes, that you are getting the correct or accurate information. So don't be afraid to communicate with your healthcare provider. And then another job function that comes along with being a medical coder is just making sure that, the claims are being submitted to the insurance company or the payers appropriately. Again, this also kind of ties into that billing part or billing role. But pretty much, nonetheless, we are the health information, the healthcare services interpreter, translator, and all of the above. Compliance, like we make sure that we're following the rules, that we're coding accurately, and that we're doing within the law. So that's pretty much what encompasses a medical coder. Now we're going to take all of that I just spilled, and we're going to break it out into different roles, because there are actual roles for those different components that I just discussed. So Number two, AI said coding specialist. Again, coding specialist, certified medical coder. To me, they're all the same. I think, again, it goes back to the healthcare organization and how they entitle or list that particular role and what that role does encompass. Okay. Coding auditor. Now this role I have held, and I held this for, in various organizations in various capacities. Now, when I became a auditor, I was auditing the providers. I was auditing the physicians. I was auditing the physicians, the mid-level providers such as the nurse practitioners and the physician assistants or PAs. I was auditing the providers. Again, this is when I first started in auditing. And because we did that, the reason why we did that is because they were the ones who were providing the service, right? So again, in this case, you definitely have to be able to communicate with the providers because you're auditing them. So what that encompasses is, of course, they provide the services. Now, again, the audits could be prospective or retrospective. So prospective just means that it was done prior to it being billed. Retrospective is the audit was performed after it was billed. And so, I was able to audit the providers and then had to communicate with the providers what the findings were, whether they were good, bad, or indifferent. We had to communicate with the providers. So that's the role of a coding auditor. Another task that is included in the coding auditor is how you procure the information, like how do you know what you're going to audit? So you have to come up with a plan, or the organization or your manager have to come up with a plan on, like, what are we going to look at? What's the scope? You may hear that as an auditor, like, what's the scope? The scope is, what will the audit process consist of? What services are we auditing? What providers are we auditing? What date ranges are we auditing? And then what are we looking for? And then once we solidify what the scope is, then we compile all the information or the findings in a report, and we relate that information back to the providers or the leadership or executive team in which I guess oversees that provider or that provider group practice. And also it allows for us as coding educators, which I will jump into that job after this, to find opportunities to find education. Like, what are the opportunities? Where do we find that the provider needs education on? Like, what are their weaknesses? What's the redundant issue that we're seeing in the audit that may require an opportunity to educate the provider, or it may come across like the provider is not aware of it. Some of them may be aware, and some of them are honestly, they don't know. So that's an opportunity to educate the provider. So now that we are talking about education, let's talk about the education role. So there's many people, thanks to the internet, who are deemed, and I'm air quoting, to be coding educators. And I'm not knocking anybody. Let me put that disclaimer. I'm not knocking anybody, because everyone has a unique perspective or unique gift to coding, and they want to share that with the world. Because there are people who may have that same perspective, and that's nothing wrong with that. I encourage individuals, if you have a perspective and you feel that there's others that are, it will fulfill a need or help another individual, by all means, go for it. So no, this is not like to belittle anyone who doesn't meet the requirements of a coding educator. Everyone at this point is an educator. But according to, again, my friendly friend AI, a coding educator, pretty much they should have at least an associate degree and at least 5 years of experience in the subject matter in which they are trying to educate another individual on. So, for example, I have a credential in general surgery. So if I said I want to teach someone general surgery, I am qualified according to the requirements to do so, or I should say the AAPC requirements to do so, because I have the credential as a general surgery coder. I have at least 5 years experience as a general surgery coder. And I've also taught on a collegiate level as it relates to healthcare coding and auditing in general surgery. So I can officially say that I am educated to I meet the requirements to teach general surgery. And I will also say that I do have my credentials as an educator to educate. But like I said, but there are some who may not have the years of experience. They may not have the credential to be a coding educator, or they may have the experience, but they may not have the credentials either to be a specified or a specialty educator, or just a coding educator. But hey, again, the internet is available for anyone. If you have a perspective, you can share that perspective, your unique perspective, to others. There's nothing wrong with that. And so so that's what the AAPC, again, the AAPC, and I would assume AHIMA as well, those are the requirements that are needed to educate the masses as it relates to medical coding. And it also just kind of solidifies your qualifications, because if so for example, if you offer a course, right, and someone, or you are sharing your information, your knowledge via the internet in regards to coding, and someone may be perceptive to your teaching, and they want to learn more, and you offer a course, so they may go and do the research just to confirm that you are legitimate or you qualify as an educator. And so you want to make sure that you do have those qualifications, right? You do have those qualifications. Again, you have at least an associate's degree. You have at least 5 years of coding experience, and have the credential. Now, will the associate degree solidify? Do I think that an associate degree is required? No, I don't think so. Excuse me. I don't believe that an associate degree is required to teach coding, but it does show that you were disciplined enough for 2 years to get a degree, right? It does show discipline. And as far as the years of experience, yes, for me, if you have the years of experience, the years of experience to me outweigh the associate's degree, because your associate degree could be in a different field altogether, but your years of experience, that shows that you've been in it long enough to know, at least at a minimum, some of the ins and outs as it relates to that particular topic that you're speaking on when it comes to coding. So yeah. So sometimes the experience outweighs the degree. But get your degree. And I'll use myself as an example. I have an associate degree in business management, but I have almost 30 plus years of coding experience, right? So if someone was to hire me, they would say, okay, she went to college, her degree is in business, but her experience in coding and compliance far outweighs that of her associate degree. So yeah, so you see what I'm saying? The experience. So I kind of went back and forth over the list. So we talked about auditing, we talked about just being a medical coder, and we talked about coding education. Now we could talk about consulting, right? We could talk about healthcare compliance, coding and compliance consulting. I've done those roles as well. So this is where I guess you could say my business degree comes in, because you have to know how to market yourself. You have to know how to network. You have to, pretty much, that's where that whole communication thing comes in. You have to be able to communicate if you're trying to be a consultant, because you have to network. You have to again, have the experience, have the education to consult others, right? To have organizations reach out to you or to hire you as a consultant to train or to complete projects, to whatever it is that they're needing you to do. And so that's why it's important that you have that. So consulting, it is a different beast. But I would say the if you haven't grasped some of the underlining, I would say, characters or characteristics you should have, or gifts you should have, and that is to communicate. Let's see here now, as far as like medical coding, because medical coding can go we can go down another rabbit hole when it comes to the actual medical coding role, because you have outpatient medical coders, you have pro-fee or the professional coder, and then you have the inpatient or facility coding. So there's various coding certifications that are out there. And I don't want to dive too deep into that because that's a whole nother episode in itself. But there are different certifications. There are different perspectives or aspects of medical coding. So there's pro-fee coding. The pro-fee coder is the coders who specifically code for the practitioner, the physician, the PA, the NP. They are the pro-fee or the professional coder. They make sure that the professional coding is accurate for the providers. Outpatient coding is for services that are done on an outpatient setting, such as an ambulatory surgery center or ASC, an outpatient surgery center, outpatient services, outpatient hospital facility. So they're focused on the outpatient aspect of healthcare. Inpatient coding is strictly for like the inpatient, like the hospital, like they're billing and coding for the hospital, the facility. So when you go into the hospital for an admission, for a stay, there's I'm going to say at least 2 or 3 different coders coding your encounter. You have the pro-fee, because the pro-fee is coding for the provider who comes to treat you. Then you have a coder who's coding for the hospital where you are staying. They're picking up all those things, the medicine, whatever it is that they're using to treat your symptoms or your diagnosis. They're billing for that or coding for that. And then there's another one. Again, if you're doing some type of outpatient services, or let's say DMEs, you have different coders accessing or coding your stay. And then you're going to bring in an auditor, because let's say they want to audit the services that were provided. So you have at least, again, I'm going to say even maybe perhaps 4 different coders, depending on their capacity, looking at your hospital stay. All right. So yeah. So which one pays more? I've heard that in the past, the inpatient coders or facility coders were getting paid more, and they probably still are. But those pro-fee coders they're making their ways up the chart. So it really depends on your jam, your organization, your skill set, what you ask for, and what you negotiate when you're accepting the role or position as a medical coder. Again, what is it that you're going to be doing as a medical coder? Are you going to be auditing? Are you going to be in leadership? Are you going to be an educator? Are you going to be just I won't say plain Jane coder, because that's just me differentiating between leadership, coding, education, and other things of that nature. So trust me, you're not plain. And so, yes, and then how you take the skills or take the task and you monopolize on that, right? So again, in the past, the facility coders were definitely making more money or had a bigger income or salary than that of a pro-fee coder or the other ones. But again, I've worked in various capacities. I worked as a medical coder, an auditor, physician, as well as coding auditor, a consultant, educator, did I say leadership? So yes. So it depends. It really depends. So what do I recommend? Honestly, I would have to deem it on a case-by-case scenario, and then also just kind of get an idea of where your heart lies. Like I've coached individuals who wanted to pursue coding, or they want to pursue a particular area of coding because perhaps it's something personal to them. Others went in it for the revenue, the income, the salary. Some individuals went in it because they wanted to be remote. So it really depends on what it is that you're seeking, like, again, personally, I can't put an overall recommendation on something that may be personal to you, because I could, let's say if I say, okay, you should be an auditor, right? But auditing may not be your jam. It may not be the thing that lights your fire, that makes you jump out of bed in the morning, whether you are remote or you on site. That may not be what you want to do. And so you take that and you do something else with, like, you may want to be a coding entrepreneur, and that's fine. If that's your jam, go for it. You maybe coding content creator, that's also fine. So whatever makes you excited, gets you up out the bed in the morning, and sets your soul on fire, I say pursue it. But the as far as the salary of these roles, that's another episode that I would have to unpack as well, and just to kind of talk about, because again, that varies, again, depending on what your role is as a medical coder. And I'm sure it also has to do with experience, years of experience and things of that nature. But yeah, so I think I unpacked pretty much the main of the roles, because again, AI just really broke them all out. And some of these are very overlapping. I said that wrong, but they are overlapping. So again, we have the medical coder, you have a coding manager, director. And actually, I didn't talk on that one. So yeah, so what they're saying is a coding manager, director, they oversee, that is the key term, they oversee the coding operations, they're making sure they're monitoring or managing the staff. I won't say monitoring, but they're managing the staff, coding staff. They want to ensure that they're meeting the productivity standards as well as the quality standards as relates to coding. They develop and they implement coding policies and procedures to ensure accuracy and efficiency. They do the hiring, the training, as well as the evaluation and the performance of medical coders. And then, of course, they get with the auditors to facilitate auditing. So they have those auditing members to ensure that the coders that are doing the actual coding are providing accuracy and efficiency in their day-to-day coding processes. So yeah, so let me go back. So we got coding management, leadership, we have coding auditors, we have medical coders, we have coding educators. So that again, that is the basis of what the coding, the different coding roles that are out there. And I'm sure there's more. Matter of fact, I know that there is more. I just won't delve into that, because again, that's a whole nother, we'll be down the rabbit hole, and we'll be on the podcast all day if we go down that rabbit hole. But yes, so just having a medical coding there's plenty of things and avenues you can do with the medical coding certification. But for the most part, individuals who do study for medical coding, they want to actually do medical coding. And I'm not mad with them, because I would want to do that as well, especially when you're starting out. You want to get your feet wet, you want to get the experience, and then you can pivot from that point. So yes, so those are some of the roles that you can pursue, again, with your medical coding certification. And as always, if you have any questions or you're interested in learning more about medical coding, please visit my website, and that's at www.abrahammedicalcodingcoachllc.com. And I'll repeat that, www.abrahammedicalcodingcoachllc.com. I have an online course. Again, I am a credentialed medical coding instructor as well as a coach and consultant. If you have questions in regards to the course, how to register, please visit my website. If you are looking for a consultant or you want a one-on-one coaching moment with me, you can also visit my website to schedule that time with me. And yeah, so as always, code on until the next coding break. Take care.